Have you ever stopped to think about what might really be happening to your liver while you take certain medications every day? Many widely used medications, even those prescribed by doctors, can cause silent damage to the liver over time. And what's even more concerning, many people only find out about this when the problem is already advanced. But today, we're going to reveal the 5 most common medications that harm the liver, explain why this happens, and most importantly, show safer alternatives and strategies to keep this vital organ healthy and working at its best. First of all, it's essential to understand why the liver is so affected by certain substances, right? The liver is the largest internal organ in the human body and performs more than 500 essential functions, the main one being the filtering and metabolizing of chemical substances. It processes everything we eat, drink, and take in the form of medication, and it's precisely in this process of metabolization that the danger lies. Some compounds found in medications can produce toxic byproducts that damage liver cells and cause inflammation or even liver failure, depending on the dose and duration of use. Besides that, it's important to remember that the liver doesn't give you a warning when it's suffering, okay? The symptoms of a toxic liver can be vague, fatigue, mild abdominal pain, nausea, yellowish skin. And when these signs become clear, often the situation is already more serious. But now let's get straight to the point, okay? Which medications affect the liver the most, and why does this happen? All right? But before we talk about the medications, if you like this kind of content, go ahead and subscribe to the channel and turn on the notification bell, okay? And if you want access to shorter content, everyday stuff, follow me on Instagram, okay? Well, first on the list is the very famous acetaminophen. Commonly used for pain and fever, acetaminophen is safe at recommended doses, but it can be extremely toxic if taken in excess or for long periods. The problem is that a lot of people don't realize they're going over the limit when they combine different medications that contain this substance, okay? Like cold medicines, painkillers, and fever reducers. In excess, acetaminophen overloads the liver with a toxic metabolite called NAPQI, okay? Which can lead to liver necrosis. Clinical studies and hospital reports show that acetaminophen is one of the main causes of drug-induced hepatitis in the world. In second place, we have non-steroidal anti-inflammatory drugs, or NSAIDs, like diclofenac, the well-known diclofenac, ibuprofen, naproxen, among others. Although they are very effective at relieving pain and inflammation, these medications, when used frequently, can cause liver damage. They interfere with blood flow inside the liver and can trigger inflammatory reactions in liver tissue. There are also reports of hepatitis induced by drugs from this group, especially in elderly people or those who use them for a long time. In third place is amiodarone, a medication used to control cardiac arrhythmias. Despite its effectiveness in controlling heart rhythm, amiodarone is known to accumulate in body tissues, including the liver. This buildup can cause inflammation, hepatic steatosis, fat in the liver, and even drug-induced cirrhosis, according to studies published in clinical hepatology journals. In older patients, the risk is even higher due to the slower metabolism of the medication. And the fourth medication on the list here is isoniazid, which is widely used in the treatment of tuberculosis. Although it is essential in fighting the disease, this antibiotic can cause hepatotoxicity, especially in people over 50 years old. Isoniazid alters liver metabolism and can cause focal necrosis of liver cells. That's why, during its use, it's essential to have frequent tests to monitor liver enzymes. And to close out the list, the fifth drug here that deserves our attention is methotrexate, mainly used in the treatment of rheumatoid arthritis and some types of cancer. This medication directly affects cell replication, including liver cells. Its continuous use is associated with liver fibrosis and even cirrhosis, requiring strict monitoring with regular lab tests. However, knowing which medications harm the liver is only part of the solution. The next step is to understand how to protect this vital organ, even when using these medications is necessary. In some cases, it really is necessary. And to start, it's essential to never self-medicate, even though, 90% of people do it. Many cases of liver injury happen due to improper or prolonged use of medications without medical guidance. I know that getting access to a doctor these days in Brazil is sometimes really hard, especially for those who depend on the public health system SUS. But it's best not to do that, okay? That's my advice. Besides that, it's crucial to tell your doctor about all the medications you use, even those considered harmless, like teas or supplements, because interactions between substances can put extra strain on your liver. Another important strategy is to look for less aggressive alternatives. In the case of acetaminophen, for example, mild pain can be relieved with warm compresses, massages, or even by using medicinal plants with pain-relieving properties, like turmeric and ginger, always with professional guidance, preferably. For joint inflammation, practicing light exercise, maintaining a healthy weight, and using omega-3 have all shown proven anti-inflammatory effects in various studies. In addition, maintaining a healthy lifestyle is one of the most effective ways to protect your liver and even avoid the frequent use of medications. A diet rich in fruits, vegetables, legumes, and healthy fats like extra virgin olive oil and avocado helps reduce systemic inflammation, which lowers the need for painkillers and anti-inflammatory medications. Regular physical activity, once again, also improves liver function and helps prevent chronic diseases that require ongoing medication. And we can't forget to highlight the importance of proper hydration. Drinking enough water helps the liver eliminate toxins more efficiently and reduces the buildup of harmful metabolites. In other words, things that are bad for you. Another crucial point is regular medical monitoring. As I've already mentioned, I know it can be difficult sometimes, but it's important to try. If you already use medications that are potentially hepatotoxic, that is, toxic to the liver, talk to your doctor about the need for regular tests to assess liver function, such as AST, ALT, and GGT. Detecting any changes early is essential to prevent more serious damage. Finally, it's worth mentioning that the use of hepatoprotective plants like milk thistle, silymarin, has shown beneficial effects in clinical studies, supporting liver regeneration and reducing liver inflammation. However, even these natural alternatives should be used with caution and always under the guidance of a healthcare professional. All right? I hope you enjoyed this content. And if you want to keep learning about the liver, heart, and other things, other natural foods, click on these videos here on the screen. That's it for me for now. Take care and a big hug.